Good morning.
Good morning, honorable members of the committee. My name is Simrun Bal. I live in Hanover, New Hampshire. I am a physician and a member of the American College of Physicians, New Hampshire Governor's Council, and the New Hampshire Medical Society. And today I'm here to testify in strong opposition to HB 619. My testimony also represents that of the two organizations that I have mentioned, which also oppose this bill. Today I'm testifying that as a doctor, I'm highly concerned about the repercussions of this bill in terms of the effect that it may have on New Hampshire's youth. As a physician, one of the best parts of my job has been caring for people of all walks of life. And I wanted to just share one small anecdote from my time in medical training. When I was early in residency, I was working in the emergency room and took care of a young adult transgender patient who was coming in with blood kind of seeping through the long sleeves of their shirt and from their jeans. And after examining and talking to this patient, we learned that this patient had had severe suicidal ideation from shame and bullying that they had experienced in not having supportive social environments and supportive family structures. To me, that was just incredibly unfathomable and heartbreaking. And it represents to me what happens too often, which is that transgender youth are not able to access supportive social environments and have difficulties accessing gender-affirming care. And this results in anxiety, depression, higher rates of homelessness, and higher rates of self-harm. Rates of suicide are as high as 40% in transgender youth, which means that if there are 100 people in this room, imagine that 40 of us would have attempted suicide. To me, that is, again, heartbreaking. This bill proposes to ban gender-affirming care. It would ban those supportive social structures in school, and it would legalize conversion therapy, and thus it would exacerbate the healthcare disparities that I've already pointed out. I want you to imagine for a moment putting yourself in my shoes as a physician or as a parent, a teacher, and remembering kind of that pain that you may experience if some child's life ends too early because of suicide due to the harms that this bill propagates. I do want to point out it doesn't need to be this way at all. In medicine, we follow very careful evidence-based protocols that show us the importance of accepting transgender identities that also involve the use of medications, which are carefully used to put a temporary pause on puberty. These physical changes that happen to youth can be distressing, and it allows us to temporarily halt those changes. We've also notably used these medications for the past 30 years to help children who are diagnosed with the early onset of puberty or central precocious puberty. I also want to point out that there are studies by the
15 seconds left.
Recognized American American Academy of Pediatrics that point out in large cohorts that accessing these medications is really crucial and is associated with lower odds of suicide. I think with that, I want to go ahead and close, but just recognize that this bill would put medical decisions into the hands of government rather than between the patient, family, and physician.
Thank you. You're taking questions?